Welcome to the American Cancer Society National Colorectal Cancer Roundtable Blue Star conversation. We are so glad that you're here. Um, and just wanted to give you a little heads up about what we can expect today over the next hour. The hour will go quickly, but we do have a couple housekeeping rules as we get started. So we are going to record. You probably heard the voice say that you're being recorded. So hopefully that's fine with everyone. We want to give others the opportunity to listen who weren't able to be with us today. So this is being recorded, but we won't record our discussion groups. So when we break out into small groups, we won't record those. You can mute yourself if you wouldn't mind when we're presenting, just to keep the background noise to a minimum. If you do share, come off camera and let us see you during the breakout sessions. I think that makes the smaller groups so much more dynamic to have folks come on camera to share live. And some of you have already been doing this, but as you join, put your name, the state that you're from, and the organization you represent over in the chat. And please stay on to the end so that you can take our evaluation. These Blue Star conversations are a real important part of what the roundtable does. It's a way for us to talk in a more intimate setting other than huge webinars or even the large annual meetings. We get to group up, talk about colon cancer in small groups, and the way we know how to do that and make it even better is through the evaluation that we'll share at the end of the call. So please do stay with us for that evaluation, and we'll put some prompts in there to remind you. So good to see people still rolling in. Next slide, Caitlin. So what are we here for? Why are we having this conversation? Well, we wanted to let you guys know about a new task group that's part of the roundtable. So those of you that are familiar with the American Cancer Society may know that there are roundtables at the national level on a variety of topics. And those roundtables are really put to work through the task groups. So smaller task groups that are either topical or process oriented. And the one that you're tuning into to hear more about today is the state-based initiative task group. So that strategic priority team is one that comes together through a co-chair relationship with Nikki Hayes and myself. And if you don't mind going back to the last one, the goal of that task group is to talk shop about state coalition work. So if we ever cross paths with you at the annual meeting, or if you'd like to learn more about the task group, basically we get together and talk about what does it mean to lead a coalition or be a partner within a coalition and trying to move colon cancer screening rates up in our state, tribe, or territory. So we love to talk about state level, and we're so thankful for the National Roundtable to make this space for the state level work, because the relationship between the two is super important. It has to be national, state, state, national, back and forth. So we're going to get into small groups after we hear from a couple speakers, and we're going to talk about a toolkit that is available for everyone on the National Colon Cancer Roundtable's website. And it's a way to try to tailor messaging in your communities to meet the needs of the community, to really get that message through. So be ready to chat. We will ask you, like I said, to come back on camera once you get into small groups. But for now, we'll just highlight the speakers. Okay, Caitlin, I'm ready now for the next slide. I'm going to hand it over to my friend and colleague, Nikki Hayes, who's also a mentor. I've known Nikki, gosh, Nikki, it's probably 15 years, maybe a little bit longer than we started working in comp cancer. We've been here since the beginning. I was a program director for comp cancer in Kentucky and was fortunate enough to meet Nikki in those early days, and have been a friend and colleague ever since, and really admire her work at CDC and the leadership she provides. Many of you know Nikki through her role as the Comprehensive Cancer Control Branch Chief at CDC, but she wears a lot of other hats in her community in Atlanta, and we're going to hear a little bit about that today as well. But Nikki, I'll hand it over to you to talk about the toolkit that was developed.
Thank you, Katie. Thank you. Thank you. And hello, everyone. I have to, first of all, give kudos to our co-chair or co-lead, because Katie, as she mentioned, she and I have been working together for a very long time. And I promise you, every single project that we do together, every single thing that I'm asked to do, if somebody tells me that Katie Bathje is going to be on it with me, then I'm like, yes, 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 yes. So I am really happy to be here today to talk about the state-based initiatives strategic priority work group. And just to give you a little bit of information about what we're doing, I think we need to go back one slide, if that's Caitlin, and to talk a little bit about what we're doing in this work group, and also to let you know what's next, what's coming next for the group. So our charge in the group is really to identify opportunities that we can leverage the national level ACS NCCRT 80 in Every Community campaign with state-based coalition and programmatic work. We really want to do this through proactive communication, by networking, and really helping to develop resources that improve colorectal cancer screening and awareness. So you might be sitting there thinking, but I thought that was what this other group was doing. So it was a little bit of what another group was doing. We recently changed our name. We are formally the Professional Education and Practice Implementation Community Stakeholders Work Group, which we often call the PEPI Community or State-Based Initiatives. And we changed the name so that it could better reflect the work that we are trying to do and intend to do and really have the best opportunities to do to support coalitions and roundtables programs on the ground. And so hence we have the name change. We think that that gives us a much better opportunity for the roundtable to really support community level activities. And it also gives us an opportunity to learn from and engage more closely state-based coalitions, roundtables, and your partners, and the state-based screening program, CRC screening program, the comprehensive cancer control programs. It gives us a better way, more opportunities to really work together, to learn from one another, and also to support each other. So you're going to hear a lot more in the coming year about what we'll be doing as a strategic priority task group. But we're going to start here today with, as Katie mentioned, this Blue Star conversation around the recently developed toolkit. And so if we could go to the next slide, yes. So this resource is a resource around tailoring colorectal cancer screening messaging. It's a practical guide for coalitions. And the work was created primarily from a body of work that we did here in Atlanta with the African Methodist Episcopal Churches. This was a collaboration with the CDC, the American Cancer Society, and the Kaiser Permanente Center for Health Research, where we did this bootcamp translation process. And we partnered with churches, local churches here in Atlanta that belong to the African Methodist Episcopal Conference. And we were able to go into this church, create the appropriate partnerships. Really, it took us a while to do it, but we created some wonderful relationships. And we were able to really test a lot of messages that had been market tested, but we wanted to make sure that we could tailor them and customize them specifically for this faith community around colorectal cancer screening awareness. We had a wonderful experience doing that work. We've been able to engage community partners since we did the tailoring, the message tailoring, and we are really, really, really looking forward to, in a couple of weeks, celebrating in all of the churches across the Atlanta district, Colorectal Cancer Awareness Day, where we're going to showcase these messages and materials that we've developed as a part of this work. And really looking forward to just the excitement and the momentum that we've been able to build within the churches around colorectal cancer screening and what we can do to help our congregations really be more aware of screening, and then more importantly than that, seek methods to seek ways to be screened. And so enough about that. I do want to tell you about, and excuse my papers falling off my desk. I do want to say that in this guide, the guide really does emphasize 5 case studies. That it gives you an opportunity as a coalition to learn from what we've been able to do in other communities, how we've been able to really put these activities and these practices into play and effectively create tailored messaging. And so we are very, very fortunate today that we have a guest speaker from Nebraska, Ms. Tamara Robinson. Tamara is the program director for the Nebraska Cancer Coalition. And a part of her work is also featured in this toolkit as well. She has done an amazing job there in Nebraska. And Tamara, we're so happy that you could be here with us today. We're looking forward to hearing from you about your work and any updates that you have beyond what's outlined in the case study. So I'll punt to you, Tamara.
Thank you, Nikki. guys see my screen okay?
Yep, looks great.
Wonderful. So my name is Tamara Robinson. I'm the program director with the Nebraska Cancer Coalition. And who we are, just quickly, our vision is to conquer cancer together. And we do that by connecting people and resources to strengthen cancer prevention, detection, and quality of life in Nebraska. Our programs that we focus on: advocacy, education, outreach, and survivorship. And these are our action areas, and they change every year. These are the ones for 2024. And as you can see, colorectal cancer is one of our key action areas. So that is where we get our campaign. The colorectal cancer in Nebraska, thinking about, and I go back to some of the things that are actually in the guidebook we're talking about today. And one thing that we talk about is defining your target audience by referencing existing data sources. So for us to build this campaign, one thing that we have done every year is we go back and we look at statistics, pull resources, and looking at and having ones that are more specific. So it really helps your audience identify more with the numbers when you can provide local data. So we made sure every year, and these are some stats that we shared with folks when we got ready, and we launched our actual March campaign at the beginning of February, getting everybody ready, and shared these stats with them so that they know, why is this important? Why should we focus on this? That it's the second leading cancer killer in our state, giving them the new estimated deaths and cases that we got from ACS's wonderful data that they put out every year. The one that was really alarming is looking at 36% of Nebraskans are not up to date. And we kept hearing over and over that that was going to be affected by COVID. We're seeing it now in the numbers. And then also showing them that we have a higher incidence of mortality in Nebraska versus the US. This is really trying to get the point across to our folks and our partners that this is important and this is why we should focus on this. So I have to give kudos to the National Colorectal Roundtable. We have utilized a lot of their guidebooks. We've done, I think, 4 iterations of this campaign now. It all started with their 2019 guidebook. And then we updated some with the African American guidebook. And then they put out this great resource this year, the lead time messaging guidebook. And we utilized a ton of stuff out of here to update our campaign. We incorporated their facts and statistics and their recommended messaging, which were amazing, and really expanded our campaign to include those that are not yet 45, those younger adults who are at a higher risk. We use it to update our key messaging, our talking points, our flyers, our social media posts. So utilizing all of that in our campaign. We shared these statistics with our audience, and really, again, to drive home the importance of that younger population, capturing those that have been recently added with the new screening guidelines. So again, giving them numbers, and these came out of the guidebook. The incidence rates rising in under 50, giving them, again, a local specific number that 38%, only 38% of our 45 to 54-year-olds are up to date. And that this staggering statistic that in 2030, the colorectal will be the leading cause of cancer-related death among 20 to 49-year-olds. And we also focused on, because they had some of this in that guidebook, is there's prevention, the family history, and that 2/3 of young adults experience symptoms of colorectal for many months before diagnosis. So that importance of focusing on those who are not 45 yet, who might be at risk. So this is our new logo that we came up with this year. And how we do our campaign is really a 2-pronged approach. We come at it, we have partners in the clinical and public health arena that we work with. We also work with the community. So we work with the clinical and public health partners to provide them tailored messaging that they can then use for awareness and education on colorectal cancer screening in their communities. These are some of the materials that we include in our campaign, and they're all on a website that folks can go and access, and you can see at the bottom, the www.fibecne.org. When they go into the website, they are then directed to all these assets that we have there available for them. We have posters and flyers that they can just print off if they want, or if they want, they can co-brand them and stick their logo on them. We translated materials for folks. Social media is huge. So we made sure we had graphics and then the messaging that they could use with them, news release templates and talking points. So if people want to work with the media, giving them those things to support. And then TV display screens were also something that we were asked for by our partners. So these are a few of our posters, our flyers for everyone, and just the one page. And one thing that we made sure that we did, and this again is incorporating feedback, is providing multiple options for imagery. so that partners can really utilize what most reflects the demographic that they work with. So you can see the different ones here, and I would call your attention to the one on the right, because in Nebraska, our biggest disparate population is the rural population. So we wanted to make sure that we had some imagery there that the folks in our rural areas could utilize and that reflected them. So we have the option for 1- and 2-page flyers or posters. And as you can see, so the one page is, they just print off that one page there. So again, looking at that one, we included Nebraska specific data on that front page. So as you can see, it's probably kind of tiny for you, but it says, again, giving to them that, did you know that colorectal cancer is the second leading cause of cancer death in both men and women in Nebraska, making it specific to our state. And then this year we added some verbiage around risk, because that was also in the guidebook. So we added, talk to your healthcare provider about your risk and which option is right for you, making sure we incorporated that. We added a second page this year to the campaign to provide more education. So on the back page, if they want to use both sides, we included just a table about what are the screening options if you have average risk, and tried to make them in a very digestible, easy to read manner, so that, I know it's a lot of words. There wasn't a great way to do this without words, but giving them, you know, what is it? How's it completed? How often? Things they should consider, but letting them be a little more educated on the choices. And at the bottom, included an infographic about high risk. So helping folks to identify if they are at high risk. So even if they aren't 45, they may need to be screened, or if they're at high risk, they may need to consider more specific screening options. As I mentioned, we also did translated materials. We really utilized partner feedback over the years on this to add translated materials. We started with English and Spanish a couple of years ago. Last year, we added Arabic. This year, we added Vietnamese. And the other thing that came into play this year too is, as we were putting these out to our partners to kind of, you know, get their input first before we did them, was one thing with the Arabic. If you notice on all of our other ones, there is a male and a female on the flyers. The input that we got from some of our partners for the Arabic population is that we needed to have separate ones. So one separate with female, one separate with male. So we created those separately. But again, something we wouldn't have known if we wouldn't have asked for our input from our partners about that population. So just something important to remember, to be talking to your partners, if you're not from that population, to know some of those nuances that you may not be aware of. And we have TB display screens. Partners, you know, can use these in their clinics or their organizations. Sometimes they have them, you know, in their waiting rooms, or some organizations, some of our big healthcare systems have them in different areas in their hospitals. Last year, we had a rural health department that used these with local partners. They had closed circuit TV screens throughout their community, and so they were able to utilize the TV display screens. And this year, we had a partner ask, you know, hey, this is great, but could we use that as a PDF? Because we'd love to stick those in our patient exam rooms. Absolutely. I mean, we work with our partner to get what they needed, and then co-branded those for the local clinics that they work with. So again, it could be customized to that clinic. And as you can see at the bottom there, we also translated these into Spanish. And that was something, you know, partners had asked for. This is great, but we need it in multiple languages. So being able to have this be for different audiences. As I mentioned, social media, you guys know, is huge. We come up with graphics for multiple different things. And again, I have to say how thankful we are for the lead time messaging guidebook. We utilized that so much for our social media this year. Utilizing it for the messaging that we put on the graphics, focusing on that, you know, it's a silent disease. You can see, again, using some Nebraska specific data, and one of them having a post that was more about the prevention side, kind of getting at the younger folks. And at the bottom right, you can see we also translated all of our social media this year into Spanish. So having that, and then as you notice, we changed the imagery on that one to better reflect that population as well. In the middle, what you're seeing is a document that when they go out to our website, they can download the graphics, but they also can download this document that gives them messaging that they can just cut and paste, grab the graphic, paste that, and they're done. So they could have their whole messaging done for the month of March. That's right here for them to use as they want. They also have the option, if they know how to use Canva, and they have folks that do, and I've been amazed at how many people do know how to use Canva. we can give them links. So if they want to go out and they want to stick their logo on these, they absolutely can. And as I mentioned, another one of our, it's a two-pronged approach, right? So we also focus on the community. So we did create a public info page for our community members, really to provide more of a high-level overview about colorectal cancer screening and this call to action to talk to their healthcare provider about the screening option that is right for them. As you can see, again, that's Nebraska-specific data that we stuck on there to kind of get their attention. You don't see it here, but as you saw on the two-page flyer, there is that table of the different screening options for them to know that. And then we created 2 new infographics this year. You saw one earlier. So about those that may need to be screened sooner. So the top one is focusing on those things that put people at higher risk. Again, and then we also included one about the colorectal cancer signs and symptoms. So if you remember the statistic that was shared earlier about 2/3 of young adults having those and not being screened for months, we included those here. And I know it's probably tiny in the yellow, but it does direct them that if they are experiencing any of those symptoms, to talk to your healthcare provider as soon as possible. So making sure that we're also, capturing that audience as well. And we also translated this website into Spanish. So on our page, they can go, they'll get the English page, and there's also a link for a Spanish translation of this page. So we do all of that stuff, and then we have a really mixed media approach to really increase our reach and impact across the state. So we have partnered with a radio organization to do PSAs that go out statewide, and we use that key messaging that we developed, again, coming from the guidebook, incorporating some Nebraska-specific data to push out PSAs that will go out throughout the month of March all across our state. So Lincoln and Omaha are greater populated areas, but this also goes out to our smaller populations and rural populations, getting them the message out to them. We also do interviews with colorectal cancer survivors and healthcare providers. So giving more of that personal aspect, because it's sometimes really easy to dismiss this stuff when you're just hearing data and numbers. But getting personal stories, a little bit harder to ignore. We've had great success with those. They've really impacted people. Having those, we do them as their video, we share them on our social media, push them out, and then we also take snippets out of those, and they get used for the radio as well. We also have print and digital ads that we use. So we work, like I mentioned, rural is a big thing here. So we work with an agricultural partner who has a statewide publication that there will be a great big full-page ad that will go out in that publication in March, and that is going to reach over 16,000 plus farmers and ranchers across our state. And then they also have online presence, right? So they're going to have digital ads as well that's going to reach that population. So it's another way to go and target the population we're looking at. And of course, every year we do our governor's proclamation. It's just another great way to leverage earned media and to really create more awareness in our state. And one of the really fun things that we get to do is, and this is a great way to include partners as well, is the National Dress in Blue Day. So it's always the first Friday of the month. So it's Friday, March 1st this year. Every year we see growth and representation from communities across our state doing this. We use a hashtag specific to us so that way we can find them. And we just flood social media on that Friday. And it's been so much fun to watch partners participate. They have fun with the pictures. And then every year we do a fun recap video that we share afterwards to really highlight and showcase all of the partners that came out and wore blue and just got them on social media. So it's been great to see that grow every year. And we also ask partners, can they light up blue for the month of March during awareness? You can see a couple of our partners. Some people have the really cool features in their buildings, which is great and awesome. You can see a couple of them there. Not everybody has that, which is okay. You can see one partner we had where they had a blue spotlight on a feature of their building. And then you can see on the bottom, there's some really innovative ways partners have done to show support. So this person did it was a local GI practice that did a card your yard for colon cancer awareness, which was really great and something I never would have thought of. So it was a really cool thing they did. So just encouraging partners to think outside of the box on these things. So what is the actual impact when you do this stuff? It's really important to find a way to provide some type of data analytics to show your actual reach and impact when you're doing this stuff. And we track this, and every year we've seen an increase in the number of partners who participate in various ways. And the cool thing is it has enabled us to reach over 700,000 people in 2023, which was amazing. And we're hoping to grow that again in 2024 this year. And then we've been able to share our work with others across the nation. We've really been honored to work with the National Colorectal Roundtable, received an award from them in 2022. We got to come to their annual conference, talk about our campaign. And then we're featured in the resource we're talking about today, the Tailoring CRC Screening Messaging, the Practical Coalition Guide. So it's been an amazing ride and be able to be a part of these things with the National Colorectal Roundtable. So the biggest key takeaways I have for you guys is consistent messaging is key. Making sure you're utilizing evidence-based resources to really develop and implement your campaign. Again, I have to plug the National Colorectal Roundtable resources have been so valuable to us. It's evidence-based, it's been market-based. You guys have done the work, but then making sure you go back and update every year, making sure you're checking your numbers, your stats, those change every year, seeing if there's new resources available. Having a coordinated approach. For us, being able to be that neutral party that was able to bring partners together and really facilitate this statewide work has been so key. We have had so much feedback about how wonderful it has been to have one place where they can go to get materials. It's something they look forward to every year. They just know it's there for them. A lot of them are very small health departments or smaller organizations that they don't have the time or they don't have a marketing person to do this stuff. So it's an easy plug and play for them. And getting feedback from your partners is so important as well. Seeking their feedback every year when we get done with this campaign, we do a follow-up survey, asking our partners, what did they use, what worked, what didn't work, what they'd like to see us doing in the future, getting their feedback. And we don't have to wait to the end to do it, right? So, we're talking to partners throughout. And if it's possible, being able to incorporate that feedback right away if we can. And then relationships are key. That's probably the biggest one. I should move to the top, but it's really about knowing and trusting your partners and for them to be able to do that with you. They know that we're here. They know that with our messaging, we're always going to vet our stuff, being available for them when they call and just taking that time to develop that relationship so that, they trust us, they go out and use the messaging, and then it just continues to grow the relationship to do even more. Any questions or comments? You guys have got my information here, and also our Executive Director, Laura, her information is included as well. I'm happy to answer any questions that you guys might have.
Thank you, Tamara, for that wonderful and thoughtful presentation. We are going to go into small group breakouts in just a second, but before we do that, we do want to see if anyone has any questions for Tamara.
I'm going to kick us off while people are thinking.
Okay.
Tamara, could you share how you made the connection with the rural community for the publication you mentioned? I know, we often want to reach the rural population, but sometimes it's hard for people to be involved in the coalition who live in the far recesses of our state. So how did you make that relationship start?
That relationship, and I should kick this over to Laura, that relationship actually came through Laura, our executive director. She could speak to that better than me. She can come off.
Hey, Laura.
Hi there. It's a great question. I think the key is we recognize those rural partners and we have to meet them where they are. And we knew that in order to work with them, we had to be willing to place paid ads. A lot of times the auspice is that we're going to get public service announcements. Well, we've actually had to pay for a lot of that advertising. So we've had to find funders who have been willing to help us do that. And meeting them where they are. We have 93 counties in Nebraska, and Tamara and I are in our cars a lot. So we actually go to them versus asking them to come to us. With the staffing shortages that we have in the Midwest, especially in our rural communities and healthcare, it is a burden for them. So we have to make it easy for them and go to them.
There are a couple of questions, and thank you, Laura. There are a couple of questions and comments in the chat. One is that we absolutely love the new logo, Nebraska. There's another comment, a question about asking if you can share the website where we can have access to the graphics, and we promised, the roundtable promised to get that information and share it if you guys don't mind. There's another question about how did you select the languages to translate?
That was through partner feedback. Asking partners what they want to, we try not to assume that we know what our partners want to need. So going to them and asking who are they serving and their populations, and then you can't do everyone. Being able to kind of look at, okay, and just continuing to add as you can. So that was, like I said, going back and just asking what languages do they need and want.
Great. That engagement is absolutely critical. Thank you again for sharing this amazing work. We really do appreciate it. So now we all get to share. In a few minutes, we're going to move everyone into a breakout room. These are going to be random selections, but we would like for you to use the time to engage with your peers and discuss what you've learned during Tamara's presentation. We do want to encourage you to come off camera. And we also, well, to come on camera, not off camera, to come on camera. Each breakout group will have about 20 minutes. We're going to have a series of questions that you can discuss. And then if you'd like, we do want to ask you to choose someone in your group to take notes, and you can share back with the larger group. The questions that we would want you to consider, they're here on the screen, and we'll also make sure that they're in your chat as well. But we want you to consider, what are some of the communities that you may not have reached before that have lower colorectal cancer screening rates and or higher colorectal cancer incidence and mortality? After watching the presentation today, what are some innovative ways that you think you might use to reach out to those communities that you haven't reached before? And what action items are on your list to start the process so that we can increase colorectal cancer screening rates? And then the third question that we want you to consider is, have you engaged any community champions for increasing colorectal cancer screening? If you have, who are they, and how have you engaged them? So Emily has also put the questions in the chat. We do want to encourage you, if you would like, to copy them so that you'll have them with you, but your moderators should have them as well. So that being said, I think I'm going to punt. We're going to go ahead and move into breakouts.
Yeah.